In executing the all-hands-on-deck approach in response to the national health emergency, several private hospitals were given permission to test and treat patients affected by the disease. This was disclosed on Saturday last by Prime Minister Moses Nagamootoo.
I know that we are working in a cooperation with the private sector, and we have now given the green light for the private hospitals to import their own testing kits so that you can supplement and do rapid testing, both state and non-state institutions. So we are also approaching private hospitals to designate some of their space as space for treatment and management of cases affected by the coronavirus.
The Prime Minister, when questioned by reporters on whether government has a mechanism in place to ensure the fees for testing at the private medical institutions are not exorbitant, noted that government cannot be a monopoly.
Since they are private institutions, they may very well work out the conditions under which they do such testing with patients who may prefer to go to a private institution rather than to go to a public institution where everything is done free. So there is a difference between the mode of operation of either of the two institutions. But yes, in a situation of an emergency, I would think that it is feasible. In fact, for me, it is reasonable for private institutions to seek a kind of support from the state in terms of doing the test and even doing treatment.
Additionally, a number of requests have been made for assistance from the Cuban government from medical doctors and health experts to combat the COVID-19.
Some requests have been made to us to have an approach to Cuba for more medical personnel and nurses. That is the matter that would engage the attention of the Ministry of Public Health, if in fact their assessment is that they need these personnel at this time or at any time, and whether this is actively being contemplated.
Meanwhile, extensive work is ongoing at the East Coast Demerara facility, formerly the Ocean View Hotel, which is being transformed to a specialized hospital to treat COVID-19 patients. While there isn't a specific deadline, works are expected to be completed in the shortest possible time. The hospital will cater for the needs of 300 patients.
This is a huge building. I know that they are working day and night. I have set myself a personal decision that at some point I want to inspect what is happening there, but I know they've been working. But as to a deadline within these conditions of persons who want to come back from overseas, etc., that I'm sure that they're working on a short rather than a long period of rehabilitation and renovation of that building.
Guyana has recorded 45 confirmed cases of the disease and 6 deaths as of Monday, April 13. Temika Rodney reporting for the HGP Nightly News.